but what kind of went through your mind when you watched what happened last night?
Well, so my specialty, just for background, I'm a family medicine physician trained in sports medicine. So outside of the obvious shoulder injuries, knee injuries, things like that, we take care of a lot of the general medical conditions, being cardiac issues and concussions and things to that caliber. So when I actually didn't see it live, I got home, I turned my TV on, and I saw the game was paused, and I had seen the players' responses, which is the first thing that really made me raise my eyebrow. And they weren't showing the video, and then they finally showed, and I saw the hit, and I was like, I have my suspicions of what it was. And talking with folks who are in similar training of mine, had all shot messages back and forth saying, "Hey, this seemed like X, Y, or Z." So when I first saw that, then I saw the hit, and then how it all played out. It was very humbling, knowing that I am frequently on sidelines, and many of my colleagues and friends are on sidelines. And this is one of those things that you prepare for, but never want to have to use. And I think it's a very unique circumstance when such a catastrophe brought everyone's eyes to something that, in a way to honor what has happened, be prepared for something like this.
Yeah. I know athletic trainers kind of hang out in the background, but they obviously became the most important part of the game last night for sure. Do you think in that moment, there's a difference between cardiac arrest and heart attacks. Is there a way to tell right away what is happening, or is CPR your best bet for immediate treatment no matter what?
Well, it certainly depends on what the situation is, whether it be a physician, another team member, a coach, an athletic trainer. Whoever's able to lay eyes on that situation first is incredibly important. That's the decision point of saying, what are we dealing with? Is this something where we need to activate a plan? Is this person having a cardio or pulmonary event? And do we start that sequence of events to get this person the help that they need versus, recognizing, is this just a knee injury or whatever the case may be, if someone just fell on the street and did they hit their head and they're bleeding versus. So having that first assessment of what's appropriate in the situation. Is this something we have to expedite an emergency plan or triage it accordingly? And whoever that ends up being, like I said, whether it be a fellow player, a fellow athletic trainer, a physician, anyone who has seen it. And I think there are things that you can prepare yourself for in training wise to be able to recognize those things. But as most of us saw last night, there's an inherent instinct that you can tell something's wrong in certain situations. And I think last night was a very good example of that.
Yeah. So I mean, for people on the scene, do you think if it was to happen, anywhere, do you think checking pulse and breath and stuff to know that CPR is your first best bet?
Absolutely, yeah. So getting into the basics of CPR and basic life support, that's your check your scene, assess the patient or person, and then from that point making your determination of, is CPR needed, and if doing so, expediting it, starting an emergency action plan, seeing if there's a defibrillator, an AED close by, getting others in communication, activating an action plan to, get an ambulance involved or whatever the case may be.
Yeah.
Paramountly important, yes.
Yeah. How important is that quick response? Do we have like 3 minutes or 2 minutes before you lose brain function? You know what I mean? Is there a certain timeline that people kind of have in their mind when they're dealing with
Right.
an
So
emergency response?
keep in mind, we all know the term CPR, but well, what does it mean? Cardio, pulmonary resuscitation. So if you're doing CPR, they're not breathing, their heart's not pumping, meaning they're not getting air and they're not getting blood, most importantly to the head. So that activation time, so to have effective, high quality CPR and defibrillation, shocking the heart within 3 to 5 minutes has been the goal, set by the American Heart Association, for the best responses. Obviously, recognizing that the sooner the better.
Yeah. I mean, cardiac events aren't limited to the athletic field. So how important is it for people to know? Do you think most people know CPR enough to be able to save somebody's life, or is that a skill you think more people need?
I think it's a skill more people need, and everyone should have at least some exposure to it. Now, keep in mind when you say CPR, there's a difference of high quality CPR and just CPR. So having that background and the training in CPR gives you those skills to know what the ratios are with the push and the breath. How deep am I going? Taking into consideration those nuance factors. But it is incredibly important, I think, for everyone to be able to learn these skills. We had mentioned before, this happened at a large scale event where millions of eyes were watching it around the country, around the world. The fact of the matter is, these don't often happen in those settings. So, where do they happen? Well, they happen at home. They happen with family and friends. They happen when you're at the mall and airports. So, the skills are the skills. Maybe a little bit more pressure when millions of people are watching you, but that assessment, that activation of an emergency action plan, that remains the same whether you're on a football field or at home or in the airport or in the mall. So, yes, it is important for coaches and athletic trainers and physicians and coaches and staff to have the familiarity with CPR and all that and covets in that treatment plan. But I think everyone has the potential to learn that and save a life. Hopefully it's never used, but if it is, you can save a life.
hmm I think the thought of being able to save a family member, save a friend would be a motivator for people. Do you think this may be, I hate to say a silver lining, but this may be a motivator for people to, once they saw it happen in a public forum, like you said, think this could
It's
motivate people to get trained or
If it's not, it should be. It's a catastrophic event that should inspire folks to look at their level of preparedness and say, what would I do if this happened to me? What would I do if this happened to me and I didn't have an ambulance and athletic trainers and coaches and doctors around me?
Mhm.
So, and if something like this doesn't bring light to that, I'm not sure what would.